Hello everybody. I'm very happy being here today and talking with you. And I would like to congratulate the organizing committee and my dear Professor Kalokirnos, especially for organizing this conference. I have learned so many things just the few hours and so that I'm attending this conference. Congratulations again. So today I will talk about e-diagnostics. That's a new type of diagnostic devices that I strongly believe that we'll all use in the very near future. We are all already using some of these devices right now, but we don't call them just like that. So we don't call them e-diagnostics. So e-diagnostics are devices that are based on portable tests, rapid tests, but they have the additional capability of sending the results automatically in a semi-automatic way to physicians, to central systems for in order to get feedback back from the physicians in almost real time. So e-diagnostic devices would be a part of new e-health systems, and e-health systems are needed because the cost of healthcare it's very high. So we have some data from 2015 from the WHO that says that almost in average 10% of GDP of each country is spent towards health expenditures. And this is a crazy high number. So in 2015, this number was around $7.2 trillion. And as far as clinical diagnostics is concerned, the World Bank has estimated that on 2012, around $700 billion have been spent for clinical diagnostics. This cost is very high, both for developed countries, but especially for developing countries. And the previous speaker talked about India, and we know that there is a need for low-cost, accurate diagnostics that can be affordable by general population, especially the underprivileged patients in all over the world, not only in the developing countries, but also in the developed countries. So many patients that they don't have high incomes, they face difficulties to get the healthcare that they need and they deserve at some point. So the WHO had the idea around 70 years ago that the advances in telecommunication sciences and the advances in the technology in the computer science could be used for a better and not so expensive healthcare system. So on 2005, WHO has set e-health as a top priority and has urged country members at that time to think about e-health. It wasn't something specific, so it was an idea. And they asked the country members to design their strategy and to think about it. So on the 2013 has actually urged the countries to make some laws in order to start implementing e-health. And on 2016, almost 73 countries had already a health strategy in place that was mainly on paper, but some of them, so that was the seed in order these technologies and these healthcare systems to be further developed. So in 2016, 32 US states had parity laws for teleappointments. That means that they allowed providers to charge in the same way for appointments, regular appointments and teleappointments, or virtual appointments. And on 2020, WHO published its global strategy on digital health for the next 5 years, so 2020, 2025. And they suggested something very, very interesting. So back then, they believed that if e-health systems were widely adopted, more than 1 billion people would get access for the first time in healthcare systems. So imagine the health benefit for more people having access in healthcare. And then the COVID came, the pandemic came, and for the world, I think that was we can all agree that it was a terrible thing. So millions of people lost their lives. For the e-health systems, I think that COVID has been an accelerator. So it has accelerated the changes for a number of reasons. So the first reason is that people, individuals, not so well-trained individuals, ordinary people, used rapid tests for their first time. So it was not only the young generation that knew how to use smartphones and computers, but also older people used for the first time rapid tests. They actually depended their decisions based on the results of the rapid test, so they trust them. So, and we believe that they are gonna keep trusting them in the future, not only for COVID, but for other diseases. So I think it's obvious that a rapid test has came and they are gonna stay in our lives in different forms. And this is good because this is, I think, the most suitable way to get health information in real time in an inexpensive way. So then during the lockdowns that we couldn't move outside of our homes, teleappointments had their chances of proving how good they are, or to prove that they are as good as regular appointments between physicians and patients. So especially in the US, almost all of the non-critical appointments have been performed in a virtual platform. So, so now that the pandemic is more or less finishing, systems that allow the teleappointments between patients and doctor are in place. They have been tested. They have proved that they are good and they can help the patients. And actually, they are less expensive, not only for the provider, so they are going to charge less due to high competition, especially, but it's less expensive for the patients also because they don't have to travel to the clinics, to the physician offices to have the appointment. So there is no time wasted. There is no resources for transportation wasted, and that's a gain for both the patients and the providers. There was also doctors that have seen teleappointments and a portable test with a better eye, so they were more positive about portable tests. So before the pandemic, because I'm working in this field, and I was talking with physicians, they were skeptical. So they were not so much in favor of portable tests and rapid tests, because back then there was some problems with accuracy and false results. Now I think that physicians wants to incorporate rapid tests in their clinical practice. And I think this is a very important point for e-health systems. Last one, I would like to mention that regulatory authorities have authorized many devices during the pandemic, and they have given this emergency use authorization. And all these devices have been used in the field. So the developers have got feedback from the users. They have identified weaknesses. So I'm sure that the next generation of devices would be much better than the devices that have been used during the pandemic. So I think that the foundation for amazing things is there. And e-health systems will be developed further the next years. So if somebody tries to find the definition of e-health, so that's something difficult. So there is not a specific definition. So in this slide, I had the definition from the World Health Organization that has put in a report a few years ago. So according to WHO, e-health is the cost-effective and secure use of information communication technology in support of health-related fields, including healthcare services, health surveillance, health literature, and health education, knowledge, and research. So this is a little bit vague. We can say that e-health systems would have some basic components, and these components are electronic health records. There would be systems to allow the real-time booking of appointments or would allow prescription of drugs. And some of these systems are already in place, especially systems to book appointments or systems to allow the subscription of drugs. There would be also components for teleappointments between patients and physicians, and all these three components have a solid technological foundation. So the technology to allow the further development of these components is already here. So and that's the easy part of the e-health system. So there would be no difficulty in adapting this system. So one aspect of e-health system that it's crucial, but it's not so well developed yet, is the part of e-diagnostics, so e-health diagnostic devices. And this is because we want the patients to not to have to leave their place. So we want the patients to meet their physicians remotely, if possible. And we don't want the patients to have to leave to go to clinics to give blood and to have to pay for the transportation, and there was also waste time in this process. So it would be very important if the test devices, if the diagnostic devices would be moved from the labs at homes or at pharmacies, where it would be easy for patients to go and have the tests. To develop a e-health diagnostic device is pretty challenging, because there should be several components that this device should have. So in scientific literature, we are talking about reassured criteria. This reassured stands for an acronym for several characteristics. For example, real-time connectivity, ease of specimen collection, affordability, sensitivity, specificity, user-friendly, rapid and robustness, equipment-free and simple device, and deliverable to end users. And that's characteristics that ideally all the device should have. For e-health diagnostic devices, there are some components that are more important than the others, and more challenging to achieve. For example, we have real-time connectivity. So the devices should be able to send the results automatically in central systems. This will require some electronics and some systems to support this transfer of results. The devices should be able to analyze untreated samples, and they should analyze it in a very simple way. So they should be very, very simple to use. Actually, regulatory authorities do not allow devices to be very complicated. And when we are talking about easy of use, we need to think ordinary people. We want the devices to be easy to use for ordinary people, not doctors, not nurses, not chemists, not engineers. So all these people have some extra skills that ordinary people don't have. So we need to make devices that are very, very simple to use. And this is a very crucial and very challenging characteristic to achieve. So During the last...
Professor Christodouleas,
Yeah.
are you close to the end of your presentation?
No, did I spend 20 minutes?
Yep.
Yeah, okay, so I will speed up. So there are some markets, there are several devices in the market already. So we have smartwatches, pulse oximeters, wearable blood pressure monitors, or some devices with cameras and microphones for physical examinations. And all these devices are, they have received clearance to be used as medical devices. And there are also devices that can measure biochemical parameters, just like glucometers, continuous glucose monitors, rapid flow tests, fertility monitors, lipid profile meters, urine dipstick tests. So there are several devices already in the market, but if somebody think about how many needs we have and how many analytes we need to detect, so there are more things to be done. So a few years ago, I have been asked to study the literature and to provide the status of the technology. It has been surprised that there are several thousands of studies out there that describe portable devices. However, we didn't have so many devices in the market. I'm quite optimistic. There are many very interesting technologies that are under development. And I believe that with further resources and with the need that it's obvious now, these devices will lead to very important, very nice devices for the detection of disease in the field. So my lab is also working in this field, and we have developed some interesting, I think, technologies. People that are interested can check our scientific literature. And I would like just 1 minute to comment on some challenges for the development of new devices. So we need to think that diagnostic devices are expensive to be developed. So the cost, according to some studies, a decade ago, it was around at least $30 million are needed from the beginning to the end in order to introduce a new device in the market. There is also competition from existing systems and devices. There are issues about privacy of data and how to secure the patient information. But the most important challenge is how to get regulatory clearance. And it's not only the cost, is that obviously it needs to be, a device needs to be inexpensive in order for people to afford it, but it also needs to be very easy to use, as I said before. And regulatory authorities, FDA, for example, has set specific criteria that devices needs to meet. So, and they would allow only very simple to use devices to be used at a patient's home. So in order to make this inexpensive and easy to use devices, developers need to, I would say, so they need to have few parameters in mind. So first of all, they need to focus on important unmet need. So as scientists, we want to provide solutions for everything, but we need to prioritize our efforts. So they need to form interdisciplinary teams, because these devices are really difficult to develop. So, and when you develop this device, you cannot really change it, because all the steps needs to work together and to be compatible to each other. So scientists, engineers should need to be together and start designing and making the device from the beginning. They need to get feedback from end users, because at the end of the day, the end users are gonna use this device, and finally they need to use any help they can find. So they should use any existing knowledge, any existing know-how. It's to develop a diagnostic device is a Herculean task. It's an expensive task. So any help will help a lot. So as long as I run out of time, so I would like to thank you all. Ευχαριστώ πολύ.